Okay, the last manipulations we're looking at on the foot and the ankle will be for the subtalar or talar calcaneal joint. And we'll be looking at inversion to eversion subluxations here, as well as at loose bodies, and these will be the first loose body manipulations we'll be looking at in the lower leg. The positioning of yourself for this is really quite important, and we'll have the patient laying on their side. Face me, please. And we'll drop the bed down a wee bit. And we're going to be using, again, an inertial manipulation, but this time we'll be using some stabilising features as well. So if we look at the inverted calcaneus first, we need to take it into eversion. So we'll have the patient lying on their side this way and sit down. And make sure that you sit with your back to the patient. If you're sitting around this way, the thrust becomes incorrect. So have your patient back to the patient. We'll put our thumbs on the sustentaculum, which is where it's usually the anterior joint that becomes subluxed. If it does happen to be the posterior joint, and you found this by examination, then simply move your hands back. But for the most part, it will be on the anterior joint. So your thumbs need to be on the sustentaculum. You can't stabilise the talus for this. You can't get to it laterally. So any stabilisation will be done by the lateral malleolus. Essentially what we'll do is just pick the foot up like so and then flip it down. There. And at the end of the flip down, you simply thrust a little with your thumbs to force it over into that everted part. A very good description of this was given by a therapist on a course, and they said it's a bit like flipping something nasty off the end of your foot. Okay? So we'll come onto the sustentaculum, pick the foot up and flip it away from us. Okay? If the patient isn't relaxing, it is perfectly permissible to basically wobble the foot up and down until they relax. And then when you've found that they are relaxed, then apply your thrust. What you've got to be careful of, though, is that you simply don't keep on increasing the force of this flip. So at the time of the manipulation, it's a really yard long. Okay? So it's simply pick up, flip down. Okay? And you're trying to throw this into eversion. For the everted foot where you want to take it into eversion, we'll simply switch legs. I'll bring your leg over this way for me, Donna. You as the therapist stay in the same position, and this time again we'll come usually onto the anterior joint, so we'll come just in front of that lateral malleolus, like so, and essentially do the same again. We'll lift up and flip down, but this time the medial talus is accessible for stabilisation. So as we flip down, we'll simply swing our index fingers back onto the medial talus. So we'll lift up and flip down. Okay? And throw this into inversion. The loose bodies that you see here, and they do occur in the subtalar joint, give the very typical history that loose bodies give all over the body. That is of twinge pain. This pain comes on suddenly, is sharp and disappears again. And basically this is what it is a twinge of pain. The manipulation that you use for loose bodies is a little different than the ones you've used for subluxations. In these cases, they tend to be high amplitude, low velocity techniques under as much traction as you can possibly give. The idea being to flip this loose body into a non-articular part of the joint so it doesn't interfere with movement. So if we have one that is basically interfering with inversion, we'll be in the same position that we've just in for the inversion manipulation, essentially the same hand position. But this time I'll pull down through the foot to apply some traction, so I'm doing this with it. And it's a wobble, if you like, in that direction. So you're inverting it with a shake. And you're basically trying to shake this loose body across. If it was eversion that was being disrupted by this loose body, then we'll simply slip the patient back into this position and do the same as the eversion manipulation, except that we'll apply our traction again and basically wobble it over as I push through with my thumbs into eversion. Loose bodies in this joint are not uncommon, and these manipulations are something you really should practice. And it's a matter of shuddering as you do this. This is really what it's all about. But once you can get these, you can usually displace the loose body inside the joint to a non-articular part, as there's a good deal of free room inside this joint. Essentially then, this completes the techniques that we'll be using on the foot, and the next segment we'll look at manipulations for the knee. Thank you.